Data, not dates. That's what we were told it was going to be all about. Well, what is that data telling us about the unlocking of this country? Have a look at those 4 tests the government laid out. What we're going to do is go through each of them, look at the numbers, see what they're telling us, and start with this. Vaccine deployments. Are vaccines getting out quickly enough? Are they getting into arms? Well, here we can look at antibodies, the proportion of adults who have antibodies, and look, they're going up very quickly, faster actually than many people had expected, faster than many other countries, up to about 70 to 80% of all adults having those antibodies. Similar numbers when you look at the number who've had 1 jab. So that's really encouraging, going up very quickly. Whether it's near herd immunity or not, we'll have to wait and see. But that looks pretty good. The first test. The second test is looking at whether those vaccines are reducing hospitalisations and deaths in those who have been vaccinated. Here, we can break down hospitalisations by age group because, of course, you know, those over 64 have, more of them have been vaccinated. We can look at hospitalisations among those under 65. They're starting to creep up, so that's going up a little bit. But now compare that with those who are 65 and over. They are basically flat at the moment, if anything, going down. And the gap between those two is really encouraging, especially given that that dark line has been above the yellow line for most of this pandemic. So that's encouraging on the first 2 of those tests. But now let's get to the third of them, looking at infection rates. So cases across the UK, are they going up, basically? And here, the picture is slightly less encouraging. Have a look at that. Well, it doesn't look that bad there, does it? That little rise on the far right. But now let's look at the same chart, same data, but with a logarithmic scale showing you the growth profile. And when you look at the growth profile, the logarithmic axis, it does look more worrying, doesn't it? Actually growing by about 7% a day on average over the course of the last week or so. Now, if you compare that with what was happening in September, it's not quite as steep, so that's perhaps relatively encouraging, but still 7% is quite a lot. And if we extrapolate that over the course of the next few weeks, well, here's what it implies. We're talking about getting to about 10,000 cases a day by June the 21st, of course, that unlocking day, and then getting to over 20,000 by the end of the month. That's just an extrapolation, of course, so that, you know, it's not a forecast, but that might be concerning for those looking at these numbers. Finally, new variants. Of course, so much focus on these variants recently. And if we have a look at the profile, the growth profile of those variants, was a pretty clear picture here. This shows you the South African variant and just how much it grew after it got past 10 cases. This is the Kent variant, and what we're just comparing is the steepness of the lines here. And now look at the Indian variant, the Delta variant. It is up so sharply that actually it now accounts for over 90% of all of those cases. More transmissible, potentially more severe as well, so more hospitalisations when you look at the impact of it. Take that test, take the previous one, not looking so encouraging. The first 2 looking pretty good. So 2 out of 4. We'll have to wait and see what the government makes of it all.